Good evening to one and all. Today my presentation is on acute coronary syndrome in young, which is a tertiary care experience with reference to coronary angiogram. I am Dr. Sai Monito from NRI Medical College, Vizag. So coming to the background, acute coronary syndrome is a potentially life-threatening condition which is more common in elderly people and young are relatively protected. Currently, the protective effect on young from coronary disease is taken away by several risk factors. So the aim of this study is to determine the conventional risk factors and angiographic correlation of coronary artery disease in young age, that is less than 40 years, to that of elderly age, that is more than 40 years. The materials and methods were, this study was a hospital-based retrospective cross-sectional analytical study involving 1151 patients of acute coronary syndrome admitted in cardiac ICU from May 2019 to May 2020. Among these patients, coronary risk factors such as smoking, diabetes, hypertension, dyslipidemia, and family history were studied. So based on this, patients were divided into two groups. Group A is less than 40 years, Group B is more than 40 years. The patients were evaluated angiographically. The significance of each risk factor between the groups were calculated by employing this chi-square test, and the p-value less than 0.05 was taken as statistical. So the results we got were, out of 1151 cases which were included in the study, 120 cases were less than 40 years of age. The prevalence of CAD in young in our study is 10 to 10.42% with male preponderance. P-value is statistically significant, that is less than 0.05 among younger individuals for smoking, dyslipidemia, obesity, family history. Of the 120 cases with the critical CAD, single vessel disease predominantly, the left anterior descending artery was the most prevalent. Single vessel disease and recanalized coronary arteries were statistically significant among younger age groups, where triple vessel disease is statistically significant among elderly. And the thrombus burden is also more among young when compared to elderly. In this, finally, we concluded is that AC is less common entity in adults less than 40 years. According to recent epidemiological trend is probing and constitutes a challenging for both patient and treating physician. Coming to introduction for what we are studying, coronary disease is an emerging health problem in India. Various risk factors contribute to increased prevalence of CAD in different age groups. Coronary vascular disease and its complications accounts for approximately 12 million deaths annually in the Indian subcontinent. The Global Status Report on Non-Communicable Diseases has reported that in India, coronary vascular disease is more than 2.5 million deaths in 2008. The leading cause of non-communicable disease deaths in 2012 was coronary vascular disease, which accounts for 17.5 million deaths or 46.2% of non-communicable deaths. As per 2014 statistics by World Health Organization, 26% of total mortality in India is contributed by coronary vascular disease. The mortality of CAD is higher among South India, and the mean age of first presentation of acute MI in Indians is 53 years. Studies carried out in India and other places suggest that Asians in generally and Indians in particular are at risk of MI at a younger age, that is less than 40 years, and the heart diseases are arising in Asian Indians and in present 5 to 10 years earlier than in the other populations around the world. Various studies has considered the age limit varying 35 to 55 years. In our study, the incidence of CAD in younger individuals is about 12 to 16% higher than that of ethnic groups. Several studies were done and analyzing the risk factors of CAD in young, such as multinational monitoring trends and determinants in cardiovascular disease study, inter-heart and Euro-heart ACS epidemiological studies, along with this of randomized controlled studies. Certain risk factors such as family history, obesity, dyslipidemia, and use of tobacco products are more potent predictors of outcome in the young rather than the older counterparts, and the very limited data has been available for the prevalence of various CADs. Keeping this in view, a preliminary study was carried out to compare the conventional risk factors in young and elderly in the patients with ACS. This study also includes assessment of critical CAD in both groups angiographically. So here the methods and materials are based on inclusion criteria. 115 acute ACS patients, which are ACS, ST elevated myocardial infarction, non-ST elevated myocardial infarction, and unstable angina patients were admitted in ICU at Department of Cardiology and NRI Medical College, which is attached to NH Hospital from 2019 May to 2020. 20. Taking proper consent was included. Chronic stable angina patients and patients with ACS who did not undergo angiogram was excluded. These study patients were divided into less than 40 years, more than 40 years. A detailed history and examination were noted. All patients were subjected to complete hematological and biochemical investigations, including TROP-T, ECG, and evaluation of ACC. Among these patients, risk factors like smoking, diabetes, hypertension, dyslipidemia, gender, kidney disease, and angina class was studied. And echocardiogram was done, and EF was also calculated. And both the groups underwent coronary angiogram based on ACS or ESC guidelines, and CAG was done through radial route using opti-torque technique after taking patient's consent. Critical CAD was defined as 70% or more narrowing of coronary artery that results in significant reduction in maximum flow capacity. So the results we got is of 1151 cases included in the study. 120 were in the younger age group, that is less than 40 years, contributing to 10.42% of total cases. The mean age of CAD in young is 36.1 years. The youngest being is 22 years till now. The mean age of presentation of older group is 56.42. Male outnumbered the females in both the groups. Of the 120 patients, the younger group, there was 86 males and 34 females. In the older groups, males and females contributed 56 and 41 respectively. The mean BMI in younger group is 28.2, whereas in older group is 25.8. Of the 11 cases, 120 in the young age group, 10.42 was of male group. The mean age of CAD is 36.1. In the older group, it is 59%. The mean BMI in younger group is 28.2. Okay. Of 120 cases, anterior wall MI contributes to major portion of ACS, followed by inferior wall, that is 26.6%. Non-ischemic constitutes 10.83. US, it is 10.83. The same order of instance is followed among elderly group with anterior wall contributing. The risk factors of CAD among the young and elderly patients are summarized in the following tables. Based on the characteristics of acute coronary syndromes, we have divided into below 40, more than 40 based on age, sex, BMI, systolic BP, anterior wall MI, inferior wall MI, PC, ischemia, and US. The risk factors of coronary syndrome among young and elderly, the major risk factors are hypertension, diabetes, smoking, dyslipidemia, obesity, alcohol, and the family history. Ejection fraction, based upon echo, ejection fraction was taken, and based on this also we have divided into two groups. Under less than 40 years, when EF is more than 45, it is mild. 30 to 45% it is moderate, less than 30% is severe. So less than 40 years, mild it is 28, more than 48 it is 139. If moderate it is 43, more than 40 years it is 190. Severe EF less than 40 is 10, more than 40 is 514. And this is a bar diagram showing the comparison of various risk factors among the two groups, that is below 40 and the more than 40. Similarly, angiographic data is depicted in the next table, where single vessel disease and recanalized coronaries was statistically significant among younger age groups, whereas triple vessel disease is statistically significant among older age groups. And the thrombus burden is more also in young when compared to elderly. The predominant vessel involved in younger and older groups is LAD, contributing to 68.3% and 63.62% respectively. This is the analysis showing that which age group and which vessel disease is most common and where it is more prevalent. Okay, next, this is the pie diagram depicting same. That is less than 40 years, single vessel disease is 67.5%, double vessel disease is 17.5%, 3.3% is triple vessel disease, normally is 15.8%. Whereas age more than 40 years, the single vessel disease is 48.5%, whereas double vessel disease is 26.6%, 19.3% is triple vessel, and 3.1 is normal. And these are the various risk factors studied in young in coronary disease. That is, in 1986, mostly smoking has been the major risk factor. Later in the present study, the
time up.
Sir, completed, sir, 1 minute. Smoking, it is 25%, family history is 30%, dyslipidemia is only 17%. This is a comparative study of angiographic profile in acute coronary syndrome. The conclusion is that although ACS is fortunately is an uncommon entity in young adults aged 40 years, plus it constitutes important challenge for both patient and treating physician. For prevention and control of premature cardiovascular disease in India, urgent control of these risk factors. Smoking is identified as a major risk factor which needs to be strict prevention, target-oriented control of hypertension, obesity, lipid levels, glycemia required in patients with ACS, mainly males. SVD is more common with large thrombus. That's it. Thank you, sir.